This video lecture is going to cover the concept of shock. It comes from chapter 6, which covers diseases and disorders of the cardiovascular system, but I pulled it out of that chapter so that we could cover it as a separate unit. You'll find individual summary sheets, outlines, PowerPoints to help you follow along as we discuss this concept itself. Now, once we get into the PowerPoint, as mentioned, you'll notice that it in the textbook fits in with the other vascular and cardiac diseases, but we're going to cover shock by itself. Shock is an inadequate cardiac output, results in a failure of the cardiovascular system to deliver enough oxygen and nutrients to meet the metabolic needs of the body's cells. What that means, cardiac output, is the amount of blood that is ejected from the heart per minute. And so if the cardiovascular system is unable to deliver enough oxygen, enough nutrients to help the tissues perform normal metabolic functions, that's shock. We can basically simply say it's an insufficient oxygen delivery to the tissues. That's really what it comes down to. The cardiovascular system's job is to deliver enough oxygenated blood to the tissues. And if you don't have enough oxygen, then nervous tissue, muscle tissue will very quickly start to shut down and the body will go into shock. Now, there are different types of shock based upon what mechanism is failing within the cardiovascular system. Hypovolemic shock, cardiogenic shock, obstructive shock, and vascular shock. Some clinicians also refer to this as distributed shock. I'll take either one of the two terms down here. Now, hypovolemic shock is a deficiency in blood volume within the blood vessels. And so you could have a person who is causing considerable hemorrhage. They're bleeding, whether external bleeding or internal bleeding. If enough blood leaves the circulatory system, the heart can't maintain a good pressure to keep the blood flowing to everywhere, especially the brain, to deliver enough oxygen. Dehydration or diarrhea can also do this as well. And so if you've been sick for several days with a lot of diarrhea, or you've been throwing up everything for days and days and days, you're going to be hypovolemic. You're going to be fuzzy. You're going to be discoordinated. This is especially a concern for little newborns. If newborns have severe diarrhea or a lot of vomiting, they start with a small blood volume. If they've been pumping out a lot of fluids, then that's going to put them into shock very, very quickly. Cardiogenic shock, this is a decrease in cardiac output. That means the heart is not correctly functioning in pushing that 5 liters per minute. This could be due to damage to cardiac muscle tissue, valve defects, electrical interruptions like PVCs, coronary artery disease, something that overall is making the heart not push out as much blood as is needed. Obstructive shock. Something is blocking delivery of oxygenated blood to vital organs. An embolism has gone somewhere and has blocked blood vessels to the brain, or you have a blockage of atherosclerosis that's plugging up vital organs like the coronary circulation. Compression syndrome can do this as well. So if your patient has broken their leg to such an extent that they got swelling in the tissues that's compressing the veins, and the veins can't leave, and that causes enough compression that the arteries can't drive new oxygenated blood in, then you're going to be ischemic through that lower limb, and your body is quickly going to go into shock as a result of that lack of oxygen. Vascular shock, also called distributive, this is due to an inappropriate vasodilation of the arteries. Your arteries maintain an autonomic tone that maintains a proper blood pressure. And so your sympathetic nervous system, even when you're at rest, is sending signals down to keep the blood vessels at a certain tension, which keeps oxygenated blood going all the way up to the brain, feeding you oxygen. If you suddenly turn off that autonomic tone and the blood vessels dilate dramatically, that's going to drop the pressure, and you're not going to be able to deliver enough oxygen to those vital organs. There's 3 types of vascular shock. Septic shock is caused by a blood infection. Now, if you have an infection that's traveling through the bloodstream, your immune system is going to attack those pathogens. If you're a localized spot, you'd have swelling in this area. But when you've got a vascular infection, now you're going to have inflammation here and here and here and here and here and here and here. And all that whole body inflammation is going to cause so much vasodilation and so much exudate, plasma leaking out of the vessels, that you're not going to have enough volume to be able to maintain good pressure. You're going to go into vascular shock. Anaphylactic shock, this is an allergic reaction. And so if you've been exposed to something that your body is hypersensitive to and you over-release the amount of histamine, which causes vasodilation, again, whole body wide, you're going to suddenly cause too much dilation of the vessels, and you can't maintain enough pressure to keep the oxygenated blood going to the vital organs. Neurogenic shock, that's where I talked about that loss of sympathetic tone. And so if you've had spinal cord trauma that suddenly pinches off blood flow or pinches off neural flow from a certain point downward, all the blood vessels down there are going to just relax tremendously, and that's going to cause a great reduction in blood pressure, which is going to cause shock. Those are the types of shock. Now, stages of shock are different. Watch your terminology as we go through this. So with stages of shock, we're looking at how much your body is trying to compensate by maintaining cardiac output. And as that cardiac output starts to drop below optimum, we're going to see the body react in a different way. There are 3 stages of shock. Stage 1 is compensated shock. Now, this is where the cardiac reserve is between 90 and 100% of normal. Generally speaking, the body, as the name implies, compensates for this. You may be a little disoriented, but generally you are still functional. The skin will be pale. The body is trying to constrict peripheral blood vessels. It's trying to keep enough oxygenated blood in the torso around the vital organs. Blood pressure and heart rate will elevate to try and maintain that flow of blood to the vital organs, causing the limbs to take a secondary function. Stage 2 shock is progressive shock. Things are getting worse. Now we've moved beyond your body to compensate. Now you're at a cardiac reserve between 75 and 90%. You've lost almost a quarter of your cardiac output. And this could be any kind of shock. This could be hypovolemic, this could be vascular, cardiogenic, any of these, but any of these stages could be in any of the types of shock. Now, when a person's in progressive shock, now we're going to severely cut off blood flow to the outer extremities. The skin will turn cold, clammy, and blue. We're not pushing good blood out there because we're storing it in the center. Blood pressure and heart rate will drop to try and conserve energy. We don't want to run out of too much energy for the heart and for the smooth muscle around the blood vessels, so we're going to do what we can to try and maintain good perfusion of the vital organs. The patient may experience nausea and lose consciousness. That's lack of oxygen to the brain, and so we're trying to keep the brain alive, but it's not an optimum level. Stage 3 is called irreversible shock. Now, I don't love the name. You can still survive it, but things are really, really bad. You're below 75% cardiac output. Well, that should be a cardiac output of below 75%. I will fix that. And so with a cardiac output below 75, now you're going to basically shut off the limbs. You won't feel a peripheral pulse. You might feel a small central pulse, but now to the point that you are completely ischemic of limbs. Severe medical intervention is required because you're going to start having infarction of tissues as long as you stay in irreversible shock, and that's going to then collapse the rest of the system. Now, if a person is in shock, they're going to present with initially tachycardia, dizziness, diuresia, diaphoresis, and nausea. I want you to review these terms, be able to define them, and I want you to explain why are they occurring during shock. Some of these are smart compensation mechanisms. Some of these are unfortunate poor reactions due to tissue exhaustion. You need to figure out which is which. So define the terms and describe why they're occurring and either why they're supposed to occur or why it's making things worse. Diagnosing shock, the most common way we do this is the FAST assessment, F-A-S-T, focused assessment with sonography for trauma. Basically, FAST is an ultrasound technique used to evaluate trauma patients. We're looking for things like internal bleeding in the torso. We're looking to see if you're quickly, so we're looking basically for hypovolemic shock. So we'll do a quick ultrasound of the pericardial, peritoneal. As we run through these, we're trying to monitor and make sure that we're not losing a lot of blood in the wrong places. Limitations can be the fact of if you have small amount of bleeding, if it's not a rapid arterial blow throughout the thoracic or abdominal area, then slow bleeding, say out of an extremity causing compression syndrome, may not show up with the FAST assessment. You may also take a look at some patients who are severely obese or pregnant, and there may be enough structures and tissues in the way that ultrasound doesn't give you a good clear view of the abdominal or thoracic cavities. That's a super quick run through of shock. Make sure that you can define the different types of shock and the different stages of shock and be able to explain the signs and symptoms and the FAST assessment. If you have any questions, please reach out. Good luck.